Hey Tim,
Hey now.
how are you today?
Fine, thank you.
What's our rep of the day?
Rep of the day, manual therapy facilitates exercise.
And what are you thinking here, Tim?
I call bullshit, Darren.
Do you?
Yeah, I do.
Why is that?
Well, as far as I'm concerned, that line is really a crutch that manual therapists lean on to justify continuing using manual therapy while they also provide management under the biopsychosocial model.
Well, I would use manual therapy at times to help pain or help restrictions in movement. Does that sound all right?
Yeah, I use it as well.
Yeah.
Absolutely.
Yeah. What I do see a lot of people looking at reports from physios and they go, they've got full range of motion and full range of motion, no pain, and they'll do manual therapy. Like, that doesn't make sense.
Correct.
Yeah. Why is it used so much?
Well, as I said, I think it's a historical thing, and people use their manual therapy while they do their talking to the patients and using their humour, and that's partly a society expectation as well. If when I go to the therapist, the physiotherapist, I'm not just there for talk therapy, I'm there to have something done.
I would counter that it's actually a physiotherapist expectation of what the patient wants, not actually always what the patient wants.
Yeah, correct.
Yeah.
And we have this thing on our patient info form when they come in saying, what do you expect to get out of the session? And surprisingly few people say they want hands-on. They might say they want pain relief, but you can deliver that in different ways. But more often than not, people are putting on there, I want a diagnosis or a plan, or I want to understand what's wrong.
Yeah. All right, what else? I was thinking if people get better anyway, right?
Yeah.
You don't have to, they get better without manual therapy.
Yeah.
Yeah.
And that's the classic argument. People say, well, I do this on my patients and they get better. But we've already talked about the 80% of people that get better in spite of what we do, and we just hang out with them for the journey. But the other part of that is the people with the same conditions that you're treating that never get manual therapy and they still improve. So how can we say these people need manual therapy?
And it does remind me of that classic Gwengel study. Shout out to Gwengel here.
Yeah.
For psychogenic headaches, where you think, oh, that's a disorder that needs manual therapy, but it was the classic design of people had manual therapy or exercise or both, and all those three groups did just as well. So you don't actually need to put your hands on. And then there's the problems with repeated passive treatments in terms of the negative effect that can have on a person.
Yeah.
Yeah.
So, in summary?
Well, I would still use manual therapy a little bit, but I think you've got to be careful about when you use it.
Yeah, it shouldn't be a crutch to lean on to justify what you're doing.
Or to tell you jokes.
Exactly.
Yeah.
All right, cheers.